Good evening. Rather, let me welcome you to this third section, special edition of the Empowerment Congress Election Ready session. This is a meeting of the Government Reforms Working Group where we dive deeper into the issues of charter reform at the city and county level, as well as how is Project 2025 affecting your everyday life. And so today we are going to dive a little bit deeper into the Measure ER. But before we get there and look at the polling data for the current governor's race, I want to bring forward a man who needs no introduction to many of you. If you are at an Empowerment Congress meeting, then you know we educate, engage, and empower because we were inspired by none other than the Honorable Supervisor Mark Ridley Thomas to give us a welcome.
Thank you very much, Pastor Eddie. Delighted that you and Mr. Harris continue to provide leadership for the Government Reform and Accountability Working Group of the Empowerment Congress. You said it. I'll repeat it. We educate, we engage, and we empower. We think information is power. We understand that information, education is a fundament to a democratic society that is civic literacy matters. And that's why we're here tonight to take care of serious business. We welcome all of you to this conversation. We know we have a good presentation set for you. Uh, we've been orderly in terms of our preparation. We trust that you will salute that by virtue of your um, involvement tonight, and I wish to thank all of you for your presence, your participation. It ain't over tonight. We have a lot of work to do between now and June the 2nd. So, with that, I would just simply say let's lean in, do all that we can to fulfill the promises of democracy. John Lewis said it best: voting is the most effective tool we have in our toolbox of nonviolent resources, and so we are obliged to exercise them in honor of those who fought, bled, and died, so that we have opportunities just like we are exercising tonight. Mr. Harris, Pastor Eddie, thank you for your leadership.
Thank you, uh, MRT, for your leadership and for your wisdom. We are at a critical moment in our election cycle. That means that ballots are in your inbox. And if you've been watching the news, you know that the big, beautiful bill for some had passed. One of the casualties of that bill has been our health care. In many ways, our frontline health care. And to talk about Measure ER, we have been graced to have with us Darren Harris, not no relation to our co-chair Vincent Harris.
Same plantation.
uh, Darren Harris
Wow.
is
Keep,
uh,
hey,
a a
keep your date.
Bruin. He is from UC. He went to UCLA.
Yeah.
Was one of the first members of the Black Los Angeles Young Democrats. Continued putting his hand on that plow of voting rights and was one of the youngest chief of staff in DC when he was the chief of staff for our now mayor, Karen Bass. And now he spends his days fighting for health care with the St. John Clinic. Why don't you give him a virtual round of applause and allow Darren Harris? So glad to see you. So glad you have joined us. We're here to talk about healthcare and Measure ER and what community clinics matter. I'm going to let you speak because you're the expert in this.
Appreciate that.
So I'll let you take the mic.
Thank you so much, Reverend Eddie, and to all the Empowerment Congress, folks, MRT, to my cousin, Vincent Harris, who I haven't seen in some
I
time.
knew it.
That was our running joke. I got in trouble one time. I told that joke to then our attorney general when she was running for Senate. She didn't like it, so I appreciate it. Vincent, good seeing my good friend Yolanda, who has been in the trenches with me. Hello again. My name is Darren Harris. I serve as the Chief of Government Affairs and Relations at St. John's Community Health, a network of community health clinics throughout Southern California. And tonight I'm going to, dive in and provide an overview on the LA County Measure ER. And I'll cover four things. What Measure ER proposes. I'll talk about some of the background and who's supporting it, what the opposition is likely to say, and then we'll leave some time for questions. At the core, Measure ER, as Reverend Eddie mentioned, is about protecting access to healthcare in Los Angeles County. And so, whereas I do work for a community health clinic, it's not just about the clinics. There are dollars in Measures ER for our school-based health centers. There are dollars to save our LA County emergency departments. There are dollars, to protect and backfill a lot of the community-based organizations that were stripped from doing the work that they were doing when the Trump administration, took power in Washington, D.C. And so we are at a serious time when our healthcare safety net is under serious pressure. I do want to be direct about one concern that was flagged for me earlier. Some folks that we're hearing are having major, apprehension about this being a sales tax. And I will tell you that before we started, we did look into, other mechanisms, but we're very limited when we come to LA County. And I would tell you that before we sought out this measure here, we went and we brought the fight to DC, with the big bill. We went to the state to see if they could backfill a lot of those cuts. And so we knew that the battle was going to be on our home front turf here in LA County. And so we had to deal with the tools that we were dealt with. And so the apprehension around the sales tax is understandable because I understand you, like me, are feeling the cost of living every day. Rent is high, groceries are high, gas is now high, and families are stretched. But I want to be very clear about what Measure ER actually is. It is a half a penny. It is time limited. It lasts 5 years. And the idea is to create a temporary local bridge with just enough time for Washington, D.C. to get their act together and for Los Angeles County to protect healthcare access for everybody in the meantime. Again, I want to say it's a half a penny, time limited. It's 5 years. And the idea is to create a local bridge with just enough time for Washington, D.C. to get their act together to protect healthcare access here in LA County. I will also say that it also includes accountability. There is a citizen oversight committee and an independent audit so that the public can see how the money is being used. And so this was not placed on the ballot casually. The Los Angeles County Board of Supervisors, placed Measure ER on the ballot with 4 of the 5 supervisors supporting it. So tonight, I don't want to avoid the tax question, but I do want to frame the bigger question. What happened if these healthcare resources are not provided within LA County? What happens to our healthcare delivery? What happens to our clinics, our hospitals, and our emergency rooms? What happens to the general public when we see people lose access to care? And so that is the core issue that we're talking about with Measure ER. And Measure ER will be the local response to a healthcare crisis that is being driven by federal cuts in DC, but also the state budget pressures in Sacramento, as we deal with rising healthcare costs and the growing need across LA County. And so Measure ER is a measure that will create a dedicated local funding source to protect and restore essential healthcare services. We understand we're facing, major, pressures against the safety net. And so It will support access care for low-income residents or uninsured residents. So as folks are kicked off of healthcare, as we see what is the attention in DC, they will have somewhere to receive the care that they need. So it's really about protecting the healthcare for the folks who are at risk for losing healthcare every single day. And I can tell you at St. John's, we see this every single day. For many families, community clinics are not just another healthcare option. For many of them, we are the front door to the healthcare system. And so people come to us, for primary care at St. John's. This is my St. John's commercial. Dental health, behavioral health, prenatal, vaccines, medications, case management, all, helping the most vulnerable folks navigate this very complicated and expensive and very confusing healthcare center. So what Measure ER is doing is ensuring that that good work continues to be done, because we understand, you and I, that it's not as if folks are going to stop getting sick. If someone loses coverage, they'll still need care. And so it will show up in untreated conditions. We know that folks will continue going to the hospitals and someone will have to pay for that. And in our emergency rooms, that can mean longer wait times, and it could mean a weaker healthcare system for everyone. And so that's why Measure ER, matters. It's not just about one clinic, one hospital, or one program. It's about protecting the entire healthcare delivery across LA County. And so, as I mentioned before, it does include a sales tax proposal. And I do want to be clear about that. But it is a half penny sales tax, and it's temporary. And as I mentioned before, it's only for 5 years. And that matters because it's not an open-ended tax like some of the oppositions are trying to illustrate how the bill may be, as if it's just a blank check for folks. No, it's not open-ended. It's time limited, and it's a local response to the federal and state healthcare crisis that we're dealing with. And as I mentioned before, it also includes accountability protection, such as the Citizen Oversight Committee and the and an independent audit as well. For the background and folks who are supporting the measure, we have really built a grassroots campaign, from every sector of the healthcare delivery system, from different community-based organizations. And so I did put something in the chat. If you want to, you can just click the link and you can go through all of the folks who are supporting Measure ER. But I would try to tell you that this started as a community response. A few of the community clinics got together and we saw what was happening in the state. And so we did do some, polling, and we saw that folks were very concerned about what was happening in DC, very concerned about what's happening in Sacramento, very concerned about healthcare, and they wanted to do something about it. And so we began to build this coalition. We began to collect signatures. However, in doing so, we knew that this would be on the ballot in November. Well, a lot of the cuts that are happening will start as early as July. And so we knew that we wanted to ensure that those folks, there was no lapse in coverage. And so in order to get it on the ballot in June, we went to the Board of Supervisors where it passed, with a 4/5 majority to be placed on the on the ballot as a response to what is happening at the federal level with Medicaid and also with Medi-Cal. And so this was our way of, coming together, building this grassroots coalition that has only grown since February when it's placed on the ballot. And so now we have folks from every single sector, community health clinics, we have labor organizations, we have community-based organizations, we have the doctors, we have the residents, we have the nurses. I'm running out of what else. We have the teachers, we have Unite Here, we have the clergy. We have a sundry of different folks who really understand what's at stake with Measure ER and are really, helping us, get this, over the finish line. Now, a few things that with some of the, opponents, are saying, and I do want to have a very, serious, conversation with the folks, and we could open it for, Q and I. Opponents will likely focus heavily on the sales tax. They would say that people are already struggling with the cost of living. They would say that it's the wrong time to ask voters for more. They may argue that the government should be doing more with the money that it already has. And they may raise concerns about oversight, accountability, or whether the funds will reach the right places. I would say that those concerns should not be dismissed. As I said before, people are feeling real economic pressure. Any tax proposal has to be taken seriously, especially in a country where so many families are already stretched in. But there are a few important facts that voters should know. Again, this is a half a penny. Second, it's time limited for this 5 years. It includes a citizen, oversight committee. And fourth, it includes an independent an audit. And so this is not a permanent, blank check, given to the county board of supervisors. It's a temporary, accountable local response to a healthcare funding crisis. And so the question we have to put in front of the voters, and then I will put in front of you, is what happens if these healthcare resources are not provided? Because doing nothing also has a cost. If these resources are not provided, we know that people are going to lose access to primary care. More people will have delayed treatment. More people will use emergency rooms as their first point of care. Hospitals would absorb uncompensated care. And as we talk about the major events that are coming to Los Angeles, such as the World Cup, the Olympics, the Super Bowl, the US Open, we will have to have a healthcare system in order to accommodate, not only the Angelinos here in the county, but also for the folks who are visiting, especially as we talk about things as a new pandemic, that may be on the rise when we know the CDC and the World Health Organization may not be in alignment with our government. And also as we talk about things that we thought that would have been dismissed for, the least the rest of my lifetime, such as, measles. And so who's going to be able to, accommodate and support, the healthcare needs, for us here in LA County? Because we know that when clinics are under resourced, such as St. John's, our emergency rooms, become the backup plan. And if they are already, stretched too thin, what happens to, the other visitors and the Angelinos or residents, are coming. So I think the right way to frame it is not saying do folks want to have a tax? The better question is, do we want a temporary accountability plan, to protect, our healthcare assets here in Los Angeles County, and to ensure that there's a local investment in healthcare sustainability. And so I'll just leave it right there because I don't want to tend to ramble. I think these are, very educated, voters. I did put the link in the chat. If you go to the homepage, you will see you can learn more about, what it does, such as the disaster preparedness, disease tracking, back then a lot of the cuts to reproductive justice and healthcare, services. And again, as I mentioned, one of my favorite, the community health centers as well. And so I'll leave it there, and I'm happy to entertain any questions.
Darren, thank you for presenting. You just stated them really quickly, but the four things that you said that this would do, it would help clinics and there's some other things, right?
Right. So number one, the majority of the dollars, I guess I should go to the funding sources. So it will create a for lack of a better phrase, a healthcare plan for those who are losing healthcare due to the big bill. We know that the big bill was crafted in a way to kind of eject folks off of healthcare. particularly around Medicaid. And so it would create a product to where those folks will have coverage, for the next 5 years. Second, a significant amount of dollars will go to restore the Los Angeles County. I'm not sure if you all read in the news, recently, but there were about a half a dozen public health clinics for LA County that were closed with no plans of reopening in some very critical areas. And so what it would do for LA County is it will provide, dollars for health services, which would go to the hospitals, which would support the emergency departments where a lot of folks will receive care if ejected. A significant amount of dollars will go to the Department of Social Services. Why? Because there's so much paperwork, and red tape and redetermination around Medicaid. And so we want to ensure that those folks, who have their Medicaid, or their Medi-Cal in California, maintain it. And so the County Department of Public Social Services is critical in ensuring that those folks, stay on the books, if you will. And then there will be a significant amount of dollars that will go to the Department of Public Health that will backfill a lot of the the good work for the community-based organizations. As you remember, when the Trump administration took power, there were a lot of folks that were targeted. If you did any work that closely resembled, diversity, equity, or inclusion, or anything that was not in alignment with the Trump administration, we know that those grants were, targeted. And so we will be able to, fund them through the Department of Public Health to ensure that those folks get the backfill, those cuts. Another bucket of dollars will go to school-based health clinics, as we know that they are the first area for many of our students, not only in LAUSD, but throughout the entire LA County. Planned Parenthood is also receiving dollars. They were attacked. If the big bill was signed on July 4th, they were defunding as of July 5th. And so, Planned Parenthood is not just reproductive health services, but, they also run community, health clinics throughout the area as well. And then there also are dollars that will go towards some cities. As you know, the city of Long Beach and the city of Pasadena have their own healthcare departments, and so we want to ensure that they, get the type of support that they need. And then there's another bucket of dollars for in-home support services. Why? Because we understand that some of the folks who need the help most, some of the most vulnerable communities, don't need 24-hour wraparound services within the clinic, but we want to ensure that they get that last mile effort, if you will, at home or within the community. And so other areas where Department of Public Health is supporting this initiative is with disaster preparedness, disease tracking, and outbreak response. And then also with vaccinations and immunization programs as well.
Thank you for that. MRT, any questions from you or any discussion?
Not at this point, Mr. Chair.
All right. I see Yolanda put in the chat. Don't forget about MLK Community
Oh, I forgot
Hospital.
about the
We'll
critical
be getting
access
some money.
hospitals. I knew it's going so many places, and so there's a significant amount of money for these critical access hospitals. MOK being one of three, the other being within the Antelope Valley. As you know, a lot of our residents from South Los Angeles, moved to the Antelope Valley, and so they have some very significant healthcare needs in the Antelope Valley, and the other would be Catalina Island as well. And so MOK, thank you, Yolanda, for that, gets a significant amount of money that is earmarked, to ensure that we support one of our critical, access hospitals within our community. So thank you. I knew I was forgetting one.
Yes. And MLK Hospital is dear to the Perma Congress. We turned out some roomfuls to advocate to make sure the MLK Hospital open. And I think some of those fighters are on the call. MRT and Yolanda, and others are here as well. Any other questions? Vincent, do you have a question?
Pastor Eddie, I'm just before we go to the questions from the two hands that are raised, might we be able to hear from Yolanda Vera, who's the health deputy for Supervisor Holly Mitchell, who's has responsibility for the Martin Luther King Community Hospital. At least she represents that area. To just touch a little bit more on how Measure ER could impact not only that facility, but beyond through the rest of the second supervisorial district.
Thank you, Vincent. Can you hear me okay?
Yeah.
Yes.
It's wonderful to be here and to see some beloved friends and family in the long struggle. I'm here as a volunteer, and in my when I do work in my working hours, I do work for Supervisor Holly Mitchell. I've been doing health advocacy for almost 40 years, and I think the main point I wanted to say is I've seen a lot of different situations, and as a lawyer have sued. And this situation is the worst I've ever seen. And part of the reason is, and Darren touched on it, that we've gone to the federal government, we've gone to the state government. There's really nothing in the May revise, and it's up to us to do something. We have to help ourselves. Back in the 1990s, when there was some other further health crises and funding crises, we had a few heroes tucked away. And in the 1990s in particular, President Clinton, then President Clinton arrived on the tarmac of LAX with essentially $1 billion check to save LA County. That's not happening this time around. It's a completely different makeup. And the financial situation is bad with rising healthcare costs. It's just, all in all, this clearly is the only option that we see. And the consequences are very dire. In the county, we have rainy day money for Department of Health Services. DPH, the Department of Public Health, runs on such a shoestring budget, they don't have reserves. And so we're going to be cutting bone there. And if you open today's paper, there's two stories about how important public health is. There's a story about measles and 5 measles cases in LA. I think there was another story about the restaurants that have to be closed because of rats and vermin. And that's the infrastructure that is at risk, along with the healthcare system, if we don't find another source of revenue. And it's real, the concern is real, and that's what prompted this initiative, which we did our very best to have it be targeted and short and accountable. And I think those are just the main points I wanted to add, just given the history of looking back at these types of situations. MLK Community Hospital, I know the Empowerment Congress has always been a champion. They are looking, I think last numbers I got from them was about 70 million or so loss a year just because of the changes in Medicaid. And this would be a huge lifeline to them to get some of these monies to sustain them. They're going to need more than this. And so we're going to push. In my work time, I'll push for the county to do more, but this is critical for them as a hospital that sees a huge volume of Medi-Cal patients, and just phenomenal. They're seeing about 130,000 visits a year in their emergency room. So thank you for your attention that you're bringing to this, and for asking good, hard questions.
Mr. Chair, Mr. Co-Chairman, I want to say a couple of things with your permission. One is a lot of credit is afforded me for the standing up of the MLK Community Hospital. I want to hasten to make the remark that were it not for at least 2 people on this call, Vincent Meredith Harris and the Honorable Yolanda Vera, that would not have happened. Vincent was in his role as a senior advisor, and Yolanda was senior health deputy. They worked together, and I have to tell you that their contribution in representing Second Supervisorial District was unmatched. And it is worth that being said and known, and they haven't turned back. Still advocating. I dropped in the chat Martin Luther King's admonition about healthcare and the inequity that it constitutes. And I trust that you will take a look at that and be guided by that. Yolanda's no stranger to the work of initiatives, of ballot measures. She understands what due diligence is about. Darren made it clear. Wake up one morning and say, let's do measure ER. A lot of work was done. A lot of study was done. Polling took place, reminiscent of when we engaged in Measure H. Yolanda was one of the architects of that effort. And so I just wanted to be mentioned that a lot of work, a lot of thought, a lot of planning, a lot of heart goes into what we are doing. Now, don't make the mistake in thinking if you're not directly dependent on county health services, that you will not be affected by this. You are dependent on county health services in ways that you don't. When you go to those restaurants and see those letters that say whether it's an A, B, and if it's a C, you ought to run for your life. And B, you ought to think twice. The point is, those are public health functions and services. But even more broadly, I wanted to be understood that were it not for the county health system, wherever you get your healthcare services and the like, whether from Cedars to St. John's, and I'm talking about the hospital, St. John's, if you're talking about Kaiser, Keck, Reagan, wherever it is, they are tied in and they function in part because of the infrastructure that the county health system provides, not the least of which are the clinics. And so all of this is intricately connected, and we need to understand it. We need to protect it and seek to improve it, as Measure ER, I believe, is attempting to do. So a big shout out to Holly Mitchell, who introduced the motion to get this piece going, who has been in Sacramento moving the business so that it can be, in fact, enacted, because it requires a legislative piece as well. And so a lot goes on that doesn't immediately meet the eye, but these efforts happen because of the dedication of hardworking staff who sometimes push the elected officials and set the kind of example that we need. I know both Vincent and Yolanda pushed me. My back is still hurting as a result of their efforts. So thank you very much. Just want to put that on the record. I can go back, take my nap now. Thank you so kindly.
Thank you for that, MRT. Let's go to thank you, Yolanda, also for your work, and Darren for sharing. There are two questions in the chat. So let's go first to JM Sales. Who is JM Sales?
Good evening, everyone. I am JM Sales. I am a semi-retired real estate professional. I'm currently a community advocate. I co-chair a advisory committee for LA Care Healthcare. I had two questions, but one was answered regarding how this would affect those LA Care members that are receiving the in-home supportive services. That was answered. My second question is Measure ER is a termed measure for 5 years. What happens after the 5 years? And then I wanted to say that I'm glad I came on because I got a better understanding of the input of restaurant, um, what's the word I'm looking for?
Inspections.
Excuse me?
Inspections.
The ratings, the
Yeah.
inspections and the
Right.
ratings.
Exactly.
Yeah, I had no idea that that was associated with Department of Health, so I can now share that information.
Yeah.
But yeah, at the end of the 5 terms, what can we expect? Thank you.
I think so. The architects, Measure ER, it was never meant to be a permanent local tax. As I mentioned before, it's a 5-year bridge, just enough time for Washington, D.C. to get their act together. And so, to answer your question, what happens after the 5 years? Our hope is that there would be a significant reinvestment within our healthcare delivery system across the country, and then those dollars that were originally set for Medicare, Medicaid, will be restored. And so that will happen after 5 years. As far as the technical sense of the measure, after 5 years, it was sunset. And so we would no longer be paying a half a penny for healthcare because, if all works out well, the dollars will be restored the from the federal and state level.
Thank you.
Thank you. Next chat is Dusty.
Have work to do.
Yeah, we got work to do.
Hi, good evening. I'm not driving now, so we're good. I'm still sitting in my car. My question kind of twofold, but how will the homeless community, the unhoused, be helped or supported through Measure ER? And many of those people, I guess I want to know how once the bill is passed, how will the word get out to folks out there in need of medical services and don't know that the funds are available and the resources are available, so they don't go looking for them? Is there a plan to do that? And will there be help for the homeless community?
Well, yes. So I can tell you right now, the community, health clinics, have a very robust street medicine program,
Right.
to where we are on the street,
Oh, okay.
Every single day, in encampments, ensuring that folks get the type of health care that they deserve. And so this measure ensures that work, can be, continued. There are questions about what the folks in DC are attempting to participate in doing, as far as the redetermination and things of that nature. But we do know that healthcare for the most vulnerable and for the unhoused is not, part of their priority. And so what this measure does is ensure, that those folks continue to get this type of support and help that they need. So yeah, that is definitely, one of our priorities, within the community health, centers.
So we go out to them. They don't have to come looking for it, basically. So
I know we
Right.
find everybody.
Yolanda, can you say a word about housing for health, which would be at risk if we do not get Measure ER passed?
Well, so there is besides one of the other categories of money as well too, just to remind folks, is that there's a little bit of money for correctional health as well too, that is built into the measure, and these for individuals so they can successfully re-enter the community and get access to care when they do. Housing for health, I mean, I think they're part of the overall fabric of
Right.
the care that is provided by the community clinics and by the Department of Health Services. And so the primary care that some of these individuals might lose would still be sustained through the measure, especially for individuals who might fall off because they can't meet the new stricter HR1 Medicaid requirements.
Yeah, so Dusky, I think the point is that there's a program called Housing for Health started under
Mitch Katz. Dr. Mitch Katz, that's right.
And when he came from San Francisco, and we can help the homeless, and that's what healthcare services ought to be doing. And so it's one of the premier programs in the county of Los Angeles.
That's right.
And for that matter, in the nation. It would be at risk is the point that I think we need to understand. Should we not adopt ER? And that's the case because so many of the services in the Department of Health Services, as distinguished from the Department of Public Health, those things are at risk in real time. And homeless persons who are dependent on the county. And remember that the county's mandate is to provide for those who are medically indigent. That's a non-negotiable. It is a part of the mandate that the county is obliged to fulfill. And so I just think this is a critical point to know and to understand.
Thank you.
Thank you. Y'all been generous with your time. Before we move on, I guess a simple question is, we were hearing give a penny, half a penny, and I'm just one person in this big county, and we talk about all things that's going to fund. So how much money are we actually talking about? Are we this measure looking to generate over the 5 years, just so people can get the grasp around what the government is being dear like on their booty around?
LA County is a very large county, as MRT and Yolanda know. And so with a half a penny, we are looking at generating nearly $1 billion annually. And so this is doing a great deal of work and protecting the safety net. And so there will be nearly $5 billion over the course of this life.
Jobs are on the line as well. If the cutting has to commence, Darren, Yolanda, maybe you can give indication of how many jobs are at stake. If measured are
now being quizzed. Within the community health center space, we know that it would impact, our budgets by nearly 1/3. But within the Department of Health Services, I should know this answer. It's been so long since I answered it.
Yolanda, you remember it off the top? Thousands, as I recall. But
it is thousands, and it's hard to get an exact number, but we're talking and projecting the possible closure at least of one hospital, at least, which employs thousands and thousands of individuals, which is part of the reason why SEIU is adamantly in support of this, because they see what's going to happen otherwise if it doesn't pass. And these are quality, dedicated public servants who would not have a job as a result and have to go elsewhere.
So the implication of that is you lose purchasing power because people who are then unemployed impact local communities in terms of what they can and cannot do with their resources. Not only the grocery stores, the small mom and pops, name it, the florists, the cleaners, all of those entities, small businesses, I can assure you will be impacted. That's why you don't want unemployment to soar.
That's right.
And this is quite serious. Darren, I think it's worth mentioning as well that it's 5 years because that's the extent of what voters would tolerate. In other words,
Yes.
we don't just pull a number out of the air. Yolanda, you remember this because we still have a post-traumatic stress disorders related to what we had to do with Measure H. Remember now, it was started out to be one thing, but we had to size it in a way that voters said, we will do this, but we will not do that. The same is applicable to ER. It's 5 years because voters have said, we're not going to give you an open checkbook. You follow me? And so
Right,
it's
right.
already been tested. And now we need to deliver it. I can tell you if it was more than 5 years potentially and generating more money, voters would say, sorry, Charlie, we're not doing that. Voters are intelligent as it relates to pocketbook issues. So this is very smart, it's very thought out, and we ought to defend it, support it, and realize we're acting in our own self-interest in doing so.
Absolutely. I mean, when we did test it with voters, everybody was concerned. Majority, I would say, upwards of about 70% of the folks that were tested were concerned about healthcare. However, when we asked folks, would you be willing to tax yourself, that number did drop, below the threshold. What got us, within nearly a supermajority was the fact that it was 5 years, the fact that it did have an independent audit, the fact that it did have a Citizens Oversight Commission.
That's
And
right.
so those were the things that we placed within the measure, along with the spending plan to ensure that voters felt confident enough in order to support, this particular initiative for healthcare access.
Wonderful. Thank you. I think that's a good place to wrap this conversation. I hope you feel educated and empowered. Now it's time for you to engage at the ballot box. And as you get ready to do that, we want to say thank you to Darren for his time. This has been recorded, and I'm going to pass it to your cousin, Vincent Harris, to lead us in getting further ready for the election. He has some poll data with the share
Thank
with
you all. Thank you. I appreciate this. Thank you.
Thank you very much, Darren. Good job.
Thank you. Good to see you all.
Thank you,
Thank you,
Yolanda.
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 So before I, oops, that didn't work. Sorry about that. Before I proceed, I wanted to make sure that everybody was clear. What it is that the county is doing is a result of the one big bill that was adopted last year in July. And it was in that bill that was authored by the Trump administration and was passed without any Democratic support in the Senate and in the House. That bill cut Medicaid funding by over $1 trillion over the course of the next 10 years. So $100 billion a year. And they timed it so that the effect of those cuts on service delivery would happen after the November elections. But the budget cycles for both the county and the state extend into next year. And so this is an effort to preempt the cuts that we know are coming down the pike in the next federal fiscal year, which runs from October through September, but coincides with the fiscal year that both the state and the county run on, which is from July 1 through June 30th. So this measure was put on the ballot by the Board of Supervisors. Next. That's basically what the ballot question is. I put it in the chat. Next. A yes vote means you support increasing the sales tax by 0.5 cent over the next 5 years. Next. The no vote means you oppose it. Next. Next. These are the arguments in support, and as you can see, Supervisor Holly Mitchell appears in the supportive arguments. The arguments in opposition are as follows. There's no need, it's unacceptable for us to backfill federal funding cuts. And that Los Angeles County already has the highest sales tax rates of any major metropolitan region in the country. And so we're risking imposing this regressive tax on small businesses and on employers that may, and on consumers that may force people to leave Los Angeles County altogether. The other argument that's advanced by the anti-tax crusaders, next. The Howard Jarvis Taxpayers Association, they're opposed to any tax. And they believe that there's nothing that government can do that can be done well. And so they're opposed to any sales tax. I wanted to make sure that we had an opportunity to see those arguments before we get into the question of the most recent tracking poll data. Earlier this afternoon, we had an opportunity to interview, for lack of a better term, Sha'Carri Byerly, who appeared at the GROG meeting 2 weeks ago. She's with Eviteris, the polling firm that is working with the California Democratic Party to track voter preferences based on the sample that they produced over the course of this campaign season. The last of their tracking polls was made public today. There's an article in the Los Angeles Times about it. And so now we would like to share with you the video of the interview that we were able to conduct with Sha'Carri earlier today. She regrets that she was not able to be here personally to share her insights, but she had another commitment. So, Courtney, if you could cue up the video. And we will not be able to show the full 30-minute long video, but we will make sure that it is posted on our website. So we'll hear about the first 15 minutes, and then I'll take the question from Nunez. But go ahead, Courtney.
Recording.
Yeah, we're not hearing anything.
Okay. So as we discussed last meeting, the California Democratic Party launched the California Voter Opinion Trend and Engagement Research Index in March to provide the public, all voters, all journalists, all residents, information about voter preferences as it relates to the California governor's race. The fourth in the series of tracking polls related to this study was recently released just today, May 19th. And so the top line results and the cross-tabulated results are now available on the California Democratic Party's website. The California Voter Opinion Trend and Engagement Research Index, or Voter Index for short, is a large sample statewide polling project in order to provide this consistent snapshot of how voter preferences are changing over time as we head toward the June primary election. And we have had some updates to the top line for this recent poll to reflect the fact that ballots have been mailed and some voters have already started voting. So I'm going to share my screen and preview those questions before we go into what we call the horse race, or candidate preferences and vote choices, as we look ahead to the June primary. Consistent with the previous tracking surveys, we have a sample size of 1,200 California likely June 2026 voters. The survey was fielded both online and with live telephone interviewers in English and Spanish this past Thursday, Friday, and Saturday, May 14th through 16th, and the margin of sampling error is just under plus or minus 3 points. So remember, we look at that 3-point margin of sampling error as a barometer of whether or not there are true differences across the point estimates of support for each candidate in the gubernatorial race. So we ask, first off, whether or not voters have actually received their ballot, and we can see that the vast majority have, 94%. Another 5% say no, or they may not have checked their mail. They don't know if they've received the ballot. And then of those who say that, yes, I have received my ballot, we asked if they've already filled it out. And interestingly, nearly 2 in 5 voters have already cast their vote. And this, even though this was only asked of those that said yes, that 37% actually represents 35% when you take the full sample into account. So over a third of voters have already weighed in for the governor's race. Of those who have already voted, 23% have already mailed their ballot in or dropped it off in an official. A small proportion, 14%, have filled it out and have not mailed it. 3 and 5, however, say that they are planning to vote, but they have not yet filled it out. We wanted to understand how people may be casting their ballot. So for those who have not yet cast their vote, we asked how they plan to do so. The vast majority, 76%, are saying that they plan to either mail it or drop it off before election day at a designated vote center or official ballot drop box. Just 20%, 19% to be exact, say that they plan. Say they're going to vote at a polling place, and just 4% say that they are going to vote at a vote center before. We see in question 4 that there continues to be high level of commitment to participate in the election. So this was asked just among those who either haven't received their ballot or have not yet voted. Consistently, since we've been polling in March with the baseline, we have nearly 90% of California voters who say that they are definitely committed to voting. Hence our likely voter screen. If they were said they do not plan to vote, the likelihood was 0, then they were screened out of the study. Consistent with our prior polling, we see that considerations of the direction of the state also remain stable over time. So this gives us a benchmark so that we know we have an apples to apples comparison as it relates to the voters that we're surveying in each of these tracking polls. We get to the horse race. These are the top candidates that will appear on the ballot, including those that may have suspended their campaign. And similar to what we saw 2 weeks ago, Hilton and Becerra are running essentially neck and neck. So Hilton is at 22% of the vote in this most recent poll, compared to Becerra, who is at 21. Those are statistically equal numbers. We have a slight uptick for both candidates, for Becerra and Hilton, from the May 2nd tracker, when both candidates were at 18%. Our undecided, if I scroll down, is fairly consistent. So this is a matter of people making their final choices. The same proportion of California voters that were undecided 2 weeks ago are essentially still undecided or haven't made up their mind. But people are beginning to consolidate around these top candidates. Underneath Hilton and Becerra, we now have Tom Steyer standing alone in the second tier at 15%. This also is an incremental increase over what we saw in the May 2nd survey. He went from 12% 2 weeks ago to now standing 3 points higher at 15%. Interestingly, a number of candidates are either falling back or remaining steady. In the fourth tier, we have Chad Bianco, who previously was leading along with Hilton in the race before the Swalwell dropout. He stands at 10%. That's down 4 points from 2 weeks ago. Katie Porter seems holding steady at 7% of the vote. She was just at 8%, so near statistically equal vote share compared with the May 2nd survey. Matt Mahan appears to be falling back as well. He's down 3 points from 7% to 4%. And we see that Antonio Viragosa and Tony Thurmond are both at 1% vote share, fairly stable from 2 weeks ago. And we still have a few voters, but less than 1%, who have selected Yee and Swalwell, even though they have suspended their campaigns. I've already gone over the undecided vote. How does the vote compare when we remind voters or share with them that Swalwell and Yee have actually suspended their campaigns? We don't see big differences in the results here. Virtually unchanged. So Hilton and Becerra are in second place at 22, in first place at 22%. Steyer is in third. And then we have in the next tier, Chad Bianco, followed by the fourth tier, Katie Porter and Matt Mahan. And then the final tier, we find Antonio Viragosa and Tony Thurmond. Well, how does the vote break out across key groups? One of the constituencies of interest is always the partisan vote. So when we look at Democrats versus Republicans and no party preference voters, just scrolling here in my crosstab document, to the top two candidates, you can see that in the initial vote, 22% of voters select Hilton, 21% select Becerra. Among Democrats, Becerra has the highest vote share at 35%, followed by Tom Steyer at 22%.
Yeah, pardon me a moment, Dr. Byerly. Is there any way to increase the size of the screen? Or
I
should
wish
say the
there
size
were.
Okay, so right, so we have the same issue that we did the last time. Okay, not
Yeah.
a problem. Just
That's
checking.
okay. If we download the document, Caden, you may be able to enhance it if you use if it's on your hard drive. So see if that's the case, and if so, we can switch between me sharing and you sharing.
Well,
the screen.
it's not a problem. I was just curious. I'm just happy to know it's not my baby boomer eyes.
No, it is a function of the massive Excel spreadsheet online that's fixed and kind of unchangeable.
Sure.
So looking on the Republican side, there also appears to be consolidation with 57% of Republicans supporting Hilton compared to 24% who are supporting Bianco, and independents are fairly divided. So we have Hilton and Becerra leading at 18 and 19% respectively, followed by Tom Steyer and Chad Bianco in third. It's always important to look at the undecideds in the race, and you can see that Democrats and independents continue to be relatively undecided. 17% is a good chunk of votes that could make a difference in candidate vote choice selection, especially at the very top tiers of the candidate ranking as it stands today. Republicans are fairly decided. 1 in 10 roughly still have not made a choice, but the vast majority have selected among those that are listed in the poll.
I have a quick question,
Yes.
Dr. Barley. If you were to aggregate the numbers, how do no party preference voters, how are they breaking along the partisan divide?
Yeah, that's a great question. We can take some cue from how the vote actually squares. And so, there's a fairly even distribution, I would say, across our Republican candidates versus our Democratic candidates. If you look at MPP voters, you have 18% for Hilton and another 14% for Bianco. So together that's 32%, about a third. And then on the Democratic side, for the top candidates, at least you have 19 and 17%. So that's what, 36%. So fairly evenly distributed when you think about the partisanship of the candidates that they are selecting.
Of the top-
because of the sample size among those no party preference voters, it's only you can see here 200, just under 250 people. We're not able to break it out across the ideological spectrum. However, but you know what, that may not be right, because we do have an ideology question, if I'm right, Caden. So let's take a look at that if we scroll down here. I'm going to see if I can use my search. No, it doesn't look like that's going to help me. Oh, there we go. Okay. So if we look at our no party preference voters, in minor party registrants, 22% identify as progressive, 13% identify as liberal. So in total, you have 35% who are either liberal or progressive, 28% say that they're moderate, and then we have 20% who say they're somewhat conservative, and 5% who say they're very conservative. So 27% total conservative to 35% liberal progressive. And then the balance largely are moderates. We also ask party self-identification. And so if we break down the vote that way, about 6% actually identify as strong Democrats, interestingly enough, even though they're registered as declined to state. Another 29% are independent but lean Democratic. 20% say they're purely independent. They don't lean toward either party. And then you have 24% who are independently Republican, 1% who are Republican, who say not a strong Republican, and 2% who identify as a strong Republican.
Thank you.
Yeah. We also had questions last time about how the vote broke out for Black voters in particular. So I'm going to scroll to that tab. So we're looking at Black, non-Hispanic, either alone or in combination. And so when we scroll up to our candidate preferences, and I'm going to use my find feature again. Let's see. Okay, this is our initial vote. Okay. But it's in order of candidates. We see 1% have selected Tony Thurmond, 10% of the vote for Porter, 12% for Mahan, 3% for Hilton, 23% for Becerra, 3% for Bianco, and 20% for Steyer. So that represents really parity between Becerra and Steyer when you think about the vote share, statistically equal, particularly for an N size of 176 voters. And then we have Villaraigosa with 2% and just under 1% who say Swalwell, but the highest proportion of undecided voters, 24%, followed closely by those who identify as Asian American. Latino voters and white voters have, far more committed voters relative to Black voters and Asian American Pacific Islander voters. You're on mute.
The Latino voter support?
Let's see. So from the bottom up, of the candidates who still have ongoing campaigns, Villaraigosa secures 4% of the vote. Steyer secures 18% of the vote. Bianco holds 10% vote share. Becerra has 31% of the vote. His highest level of support across race and ethnicity. Hilton holds 12%. Mahan has 2%, Porter has 3%, and Thurmond has 1% of the vote.
So would it Courtney, I think we should probably stop the video at this time. Becerra has consolidated. We want to be respectful of everyone's time. We have devoted an hour and a half to this conversation, so we have about 12 minutes left. We will do our level best to post the interview that we did with Sha'Carri on our YouTube channel that will be accessible both directly through YouTube as well as through the website just as soon as we are able to do so. As is also the case, we intend to post the Zoom meeting recording of this conversation to our YouTube channel and to the website in case there are individuals who are interested in reviewing the information that was shared or would like to forward it to other folks. I want to remind people that what we learned when we talked to Dr. Byerly a couple of weeks ago, polls are snapshots in time. They are representative of the samples that a pollster produces in order to conduct the poll. What distinguishes the poll that's being performed by Viteris from many of the other ones is the size of the sample and the effort that has been undertaken in order to ensure that there is a representative sampling of all of the groups that make up the total population of the state of California. And so in this case, there is a significant enough sample size among African Americans and Asian Pacific Islanders as well as Latinos to get a pretty good sense of how people are breaking demographically in the race ethnic context. The crosstabs, which slice the polling sample across various demographic and political, ideological perspectives, as well as age, uh, are available uh, at the California Democratic Party's website. And I put the link in the chat in case you want to look at those tabs that Dr. Byerly was referring to. That way you can dig more deeply if you have an interest in how youth may be performing in the various regions that were polled. That may give you uh, some of the data that you are looking for. Let me ask before I conclude the meeting with a quick review of the Empowerment Congress Election Central website, whether there are any questions or comments you may have. Hearing none, permit me to go to the, oh, I see a hand raised. Nunez.
I just quickly wanted to just put it in the air. I had heard about there being a sales tax imposed on Los Angeles residents for um, Olympic tickets. So I don't know if this was another consideration. I understand that this is on the ballot right now, but for future consideration in terms of funding for things that are going to sunset, especially during the time while these events are happening, to consider. I don't know where it came from, and I don't have my neighborhood council meeting until next week. I asked about this in February when I heard about it, and it hasn't been addressed since. And I don't know if anyone else has heard about it, but we have major events coming to the city and major developments happening. So maybe that's another source of revenue that people can consider. That's all. Thank you.
Yes. Thank you for the question. Courtney, can you put the PowerPoint back up? Because I think what she may be referring to is there are two occupancy tax related matters that are on the City of LA's ballot, which appears to be an attempt by the city to capture additional revenue from the occupancy tax. And I have a couple of slides in a PowerPoint that pertain to each of those measures. There's city ballot measure TC and city ballot measure TT. And each applies to the transient occupancy tax. One pertains to the online travel companies that will seek to capture occupancy tax from those online purveyors of hotel and motel accommodations in a way that they currently do not capture. Next slide. So that slide shows you what the issue is, characterizes what the situation is, and in the next slide, it tells you what is being proposed and what a yes vote means, what a no vote means. This information is taken out of the City of Los Angeles's voter guide. Similar information is available from the County of Los Angeles voter guide that went out to all Los Angeles County residents and breaks down various measures by municipalities within the county. Proposition TT is another effort at increasing the occupancy tax in a way that will seek to capture some of the revenue that is expected to be generated from visitors and guests during the very high profile events that will be occurring in Los Angeles beginning this year. Then I believe was it the is it the Super Bowl next year? Um, and then the Olympics in 2028. Next slide. And so this may be what it is that you are referring to, Ms. Nunez. So I suspect that probably is what you are thinking about. Okay.
Thank you so much. I had a bad connection. Thank you.
Okay, you're welcome. If you were to go to the Empowerment Congress's website, you hit the landing page, and beyond the landing page, you will, if you go to Election Central, this tab that I'm showing on the screen, you get this page. And this page contains information about the upcoming election. This is the Los Angeles County ballot measure information. And you just click on it and you'll get background information on the various measures that are. Can you guys see the screen?
Yeah.
Yeah. Okay. You get the information that you click on. Hold on just a second. I want to get to the that's not working. Anyway, I think you guys get the point, right? So we want to encourage you to go to the our website, empowermentcongress.org, and take a look at the information that we will be posting and updating as frequently as we physically can between now and June the 2nd. Before we conclude, I want to thank everyone for taking the time to share with us the information that we provided. The next meeting of an Empowerment Congress Working Group will be June 28th. Thursday, June 28th, the homeless working group will be convening. They may touch on a little more information related to the election. However, by June 28th, I'm sorry, by May 28th, if you have not put your ballot in the mail by then, please drop it off at a county designated drop box or take your ballot into a vote center to cast it to make sure that it is received. We've also provided earlier in the chat and also on that website that I just shared with you information about how to track your ballot so that you don't have to guess whether it has been received by our county election administrators, and you can ensure that the ballot has been received and will be counted. With that, I did want to mention that we will be celebrating Juneteenth. More information about that to come later, but that celebration will occur on Saturday, June the 20th. Juneteenth, of course, being Friday, June 19th. Then lastly, I just want to say that you can wrap things up this evening and go to your local PBS station and check out the highly acclaimed American Experience documentary on W.E.B. Du Bois. rebel with a cause. All right. Any questions? Thank you all. Appreciate it.